Person Like Me is a campaign within social care designed to improve and encourage compassionate, empathetic care for people in care homes living with dementia and to ensure that their human rights are being upheld. The focus is on people living with dementia because they're the ones who are more at risk of having their human rights violated. Having a cognitive impairment leaves people vulnerable because they've got limited ability to advocate for themselves or express their needs effectively. So this campaign really aims to remove some of those barriers between people with dementia and those who care for them. We want to acknowledge, that people have different needs, different personalities and different views on things, but we also want to be really aware that we all share certain common needs, certain human needs and human givens. So, for example, most of us have experienced joy, to know what it's like to love and be loved and have the desire to be accepted, to be respected, to be treated with dignity and respect and the desire to be understood. Now, many of us also know what it's like to feel excluded, to feel not acknowledged, to have our choices taken away, to feel that our opinions don't matter, to be misunderstood. So we should all use these experiences and this inner knowledge to provide care really that is based on the principles that we ourselves would hope for. It's important that those of us who care for people with dementia also are aware of our own personhood. These are the qualities that make us an individual. Self-awareness is a really big part of this message. Self-awareness and self-care. We need to be able to learn to nurture, to value and respect ourselves. If we can't do that for ourselves, we will struggle to do that for other people. Well, people living with dementia are vulnerable adults. As their disease progresses, there's an increased loss of cognition. Hence, there's a need to safeguard and uphold the fundamental human rights of people living with dementia. It becomes even more critical. It's an estimated that there's around 36.5% of people with late onset dementia who are living in care homes. And there's substantial evidence in the literature that tells us that people living with dementia do not always receive the health and social care that they need. We just need to look at the inspection reports from the Care Quality Commission and the Care Standards Inspectorate for Wales to see there's wide disparity among care home services. Some care homes were found to be very effectively led and the care was excellent, very high standards of care, whereas other care homes, it was found that there were cultures of care that were task-based, with people being treated with lack of dignity and lack of respect. And there were also found to be patterns of unacceptable behaviour that became normalised within the care home. So there are also reports from the Alzheimer's Society and high-profile reports such as the Francis Report and Andrews that have highlighted really the need for improved compassion and empathy and care. In cases such as Winterbourne View, which attracted a huge amount of media attention, found that there were systematic failings to protect vulnerable adults. So really that is the background of this campaign. The British Institute of Human Rights identify the core values that underpin human rights as being dignity, respect, fairness, equality, autonomy and choice. When someone goes to live in a care home, just the very nature of being in a community of people can give rise to potential systematic or an institutionalised approach. Caring for a large number of people with physical needs and cognitive impairment, sometimes with limited staffing numbers, creates pressure on staff. Timescales get created, certain tasks have to be completed within the day, and it's that timescale pressure really that invites us to be organised and efficient, and that isn't a bad thing. It's not a bad thing at all to be organised and efficient, but when it's coupled with a task-orientated focus at the expense of fulfilling an individual's needs, this is where we run into problems. There's a pressure to get the work done, but who are the work? People. So people can be very quickly seen as the work or as a duty or as a task rather than an individual, a person. Sometimes it starts with assumptions. Assumptions can become unspoken rules, which then lead to a culture of institutionalized behavior. So if we start with something like, we need to get Betty out of bed, okay, but then we add, we need to get Betty out of bed so that she can take her tablets safely. Fine, that makes sense. But then it becomes, Betty needs to get out of bed to take her tablets with her breakfast. Okay, so that's 3 things. But then it's when the other things get thrown into the mix that we get into complex situations. So it becomes, we need to get Betty out of bed, washed, dressed, and downstairs in the dining room by 8 a.m. so that she can be given her tablets with her breakfast. Okay, so now this might not be a problem for people who enjoy getting up out of bed really early in the morning, but for Betty it might become a problem if she's used to sleeping in until 11 a.m. for example. She might stay up late to have her, to have a supper, or she might stay up late to watch TV. For whatever reason, Betty might not want to get out of bed and be downstairs by 8 o'clock. But now she's in a care home, there's a pressure for Betty to fit in with the organisation, to fit in with the timescales that cater for large numbers of people. The medication round, the kitchen round, the routines associated with cooking and preparing food, the time available for care assistants to provide personal care. There's a belief sometimes that Betty if she doesn't have her medication by 8 a.m, then it'll be too close to her next dose, which is then at 1 p.m. And of course there's the organisational pressure to, for her to have her medications at particular times during the medication hours. It has to be according to the MAR chart and that kind of thing. And breakfast, if she has a breakfast late, then it might be too close then to lunchtime. And then what if she doesn't eat her lunch? It'll be delayed, and then of course there's the health and safety rules that say that we can't reheat the food. So if Betty doesn't have a lunch, then we can't save it for her because we can't reheat it. So then we think about the washing and the dressing time. Staff might consider that Betty's not, if she's not washed now, then later on they might not have time because then they'll be busy with lunch and they'll be busy with other things, other routines. And what if she's incontinent? Will staff then be accused of neglect if she's not properly washed? What if she gets a pressure sore or a moisture lesion? If she's left in bed until 11 a.m, what if her family come in and then see her and complain that they found her in a dishevelled, wet bed, hungry and thirsty? So then what happens? Betty's got up and is cleaned and has medication and has food, and she lets this happen because she's not independently mobile. She really has no choice. She gets washed, lifted up into a hoist, transferred into a chair, and she's taken to the dining room. But all the time she's protesting and she's resisting because this was not her choice. She looks the part. She's been cared for, hasn't she? She's now fallen asleep in a chair. She's grumpy and she's tired and she's agitated. And can we blame her? We can see just through this one example, really, the complexity involved. There are a number of issues there for staff: organisational pressure, risk aversion, fear of scrutiny, which is a very real thing, and fear of the accusation, and the sense of duty ends up taking over the choices of the person. There are care homes who work hard to ensure that this doesn't happen. The care homes who attended our focus group research, for example, shared many examples of how they cater for individuals, individual needs, to ensure that residents do have a choice. People can choose when they want to go to bed, they can choose when they want to get up out of bed, they can choose when they want to have their meals, and it's all written into the individualised care plan. There are ways of working around the routines and the settings, and just sort of really setting the environment to of the home so that it's easier to provide individualised care. I'm not saying it's easy. It's not easy. There are a lot of people to care for, and it is extra time consuming to cater for an individual's needs within a care home of many. but it is possible, and it is worthwhile doing, and it's worthwhile being flexible. I'm not going to be prescriptive about what can be done in this situation. There are a lot of different options available. I'd really like to hear from you about this. What's your opinion? I'd really like to hear from people out there who are working in care. How can we make sure that Betty is well cared for and her physical needs are catered for, and while also ensuring that her human rights are upheld, that she's treated with dignity and respect, and that she does have her choice? I'd really like to hear from you, and I look forward to receiving your comments in the blog section. When we consider the principles of human rights that underpin human rights, dignity, respect, autonomy, fairness, choice, equality, these are the principles that many of the values of person-centred care share, which also emphasises that people with dementia are at risk of losing their sense of self. So it's important that we try and uphold a person's identity to maintain their personhood. The human rights-based approach that we're advocating here adds strength to it, and it adds a legal framework to the principles of person-centred care, emphasising that it's not just considered a nice thing to do to actually care for a person's human rights and uphold their values. It's actually a legal duty under the Human Rights Act to uphold these principles. The presence of dementia or any disability doesn't disqualify a person from having their human rights upheld. The focus group research revealed numerous barriers. The focus groups included representatives from care homes, people living with dementia, loved ones of people with dementia, student nurses who had a recent care home experience that could add a fresh perspective to this. We had 7 focus groups in total of mixed people, all discussing basically what are the barriers to upholding human rights for people living with dementia in care homes, and what could we do about it? What are the facilitators to upholding them also? And the themes that come out of that research included barriers to do with systems and processes, things like risk aversion, organisational culture, financial constraints. Some of them I've mentioned in the in the example I discussed earlier. There are also environmental barriers to do with space and the creation of false realities. There are external barriers which impact on the way things are done, for instance, the pressure from public and regulator scrutiny. And, some of these things are largely outside of the influence of this particular campaign, not outside the influence of others or other incentives and other things that are going on. But what I want to work with in a person like me is some of the personal barriers that influence staff. For example, stuff that came out of the research was values, beliefs and assumptions about people with dementia, lack of knowledge and experience, some communication barriers between staff and families of loved ones of people with dementia, and also the sense of value an employee has. That's a really big thing, a really big part of this, and there are things that we can change, that we can influence as part of this campaign. So that's what we're aiming to do: work with what we can work with where we can affect change. We need to be aware of the barriers so that we can work on removing them. I'm certainly not saying that all care homes are abusers of human rights. Quite the contrary. There are many, in particular those who attended our focus groups for the research, who are quite passionate about and who are working very hard to ensure that people who live in their care homes are cared for with a person-centred approach. And many people who run care homes and work in care homes are discouraged by the media focus on abuse and the negative views of care homes. And it feels dreadful. It just feels absolutely dreadful to work so hard to provide excellent care and to put our own emotional labour into the care of people only for negative views about care homes to prevail. So that's not what we want at all. So having said that, no care home is perfect. It's important that even the extremely well-led award-winning care homes continue to seek opportunities to learn from others and also share their own good practice with other people. We all want to hear about good practice. We all want to hear what is working for other people so that we can do the same sort of things. But we also need to move away from the notion of this is a good care home and that is a bad care home. Barriers exist not just within a facility, they exist within individuals. The people who work in homes are not clones of one another. They all have different attitudes, different beliefs, different opinions and levels of knowledge and education. So it's important that we continue to research and to teach and to educate and to bring to light some of the issues that exist in care homes so that we can find ways of overcoming them and we can make things better for people who live in care homes.